here. So I will try my best to keep them straight. Sometimes IPCP is also abbreviated as IPP, so you might see those used interchangeably in my presentation today. But this is defined as any time where two or more professionals are effectively collaborating together to improve outcomes and quality of care for their clients. So we all know that we work together, right, in the healthcare world, or we should be at least. But this is really an intentional framework. It makes collaboration sort of the core piece in our healthcare delivery. So it's really thinking about this framework of how do we really ensure that our collaboration among our team members is successful and really putting our patient at the center of it. And this is really amazing for audiologists and speech language pathologists because we work in places that have so many opportunities to participate in these collaborations. So in healthcare, you can think about hospitals or clinics where we have lots of different disciplines working together and patients receiving care from many different disciplines. But the same in educational settings. If you think about a school, you have teachers, the social workers, a whole variety of people who work with our pediatric clients as well as in outpatient. So lots of opportunities to interact in our day-to-day activities with many, many different professions. So my first question for you is I want you to think for a moment, and you can either unmute yourself and just yell it out or type it into the chat. Who do SLPs and audiologists work with? And again, think broadly here, not just healthcare, think across the continuum. Good, I see the family, patient's family, excellent. ENTs, yep, definitely all types of medical doctors, including ENTs. OTs, good, occupational therapist. Physical therapists, great. Teachers, of course, we need our teachers. Anyone else? We work with so many people. So I just have some images here just to represent these. It's not a comprehensive list of who we work with, of course. But these are what we call our allied health professions here. So you'll see orthopedists, right? We work with a lot. We work with different types of therapists, including art therapists, vocational therapists. We work with radiologists. We work with pretty much everyone, dietitians, right? Even people who are in environmental services. So those are the people helping clean the hospital, keep all those areas safe for our patients. So tons and tons of people. Healthcare administrators, right? Those are the people making the policies in the hospital and how we provide services and all the rules that we have to follow. I see neurologists, good, great. And again, here, same for schools, right? So lots of different professionals that we work with. We work with teachers, we work with reading specialists, we work with case managers, students and the patients. I don't think we mentioned that yet, right? They're definitely a member of our team and people that we work with. All the other allied professions as well, like OT, PT as well, okay? And it might surprise you, right? Like if you think about, when we think about who's leading our care, usually we think it's like maybe the doctor or case manager, but that's not always the case, right? There are opportunities, and Professor Navarra, correct me if I'm wrong, but I'm pretty sure an SLP can lead an IEP, right? IEP, or try to be the lead person.
Yeah. Typically for an IEP meeting, so that's an individualized education plan, and that is what all students who are receiving any kinds of special education services, including speech and language services, need. Typically, IEP teams are chaired by a member from the district who could also be a principal or an educator. I'm not so sure about actually leading the team. However, in any IEP meeting, every member of the team has an opportunity to contribute information and their impressions of the particular child to make their recommendations for moving forward. So even while an SLP may not lead the discussion, they are certainly an integral part of the discussion. And in some cases, so for example, someone like me who works outside of the school system as a privately practicing speech language pathologist, within the context of the college, there are often times that I will advocate for the parents as a member of that IEP team at the request of the parents. So I think it's important to just point out that you don't necessarily have to be an employee of a particular facility to be involved in the interprofessional collaborative practice, and that you also have not only the opportunity, but a responsibility to advocate for your clients.
Thank you. That was a really great point. And same in healthcare, right? So I might be calling doctors from other clinics, or maybe the patient came to me from a different hospital and I'm trying to communicate with other team members from other places. So similar across. So I do have to say, my own personal experience has been that I've learned so much from these other professionals, and they really make the quality of care better for our patients when we can work together, but also the quality for us, right? They can become some of your closest friends because you kind of work so closely together. Okay, I wanted to touch on a few related concepts. So there's a lot, as I mentioned, there's a lot of terminology when we talk about interprofessional education and practice. So some of these terms that we hear are closely related, but they're often used erroneously. They're not exactly interchangeable. So I wanted just to talk a little bit about terminology. So the first one is multidisciplinary. So this is where you have several disciplines that are working side by side, but there really is little to no interaction between them. There's not a clear framework on how they collaborate and work together to help manage that patient's care. So they might interact individually with the patient, but they don't really talk too much to each other during that. That's a little bit different from interdisciplinary practice. This is where you have disciplines that practice together, and there is some communication between the disciplines with each other. But again, there's not really a clear framework and a clear way that's coordinated to really enhance collaboration for that team. So there's really no shared accountability. That's sort of like, I don't know, maybe if I see the dietitian and I'll talk to them, and oh, I happened to bump into the nurse today, so I mentioned something to her, but it's not a real coordinated process. When we talk about interprofessional practice, we're really talking about a shared framework, a cohesive and integrated way that the disciplines are going to closely work together with that patient and with each other, and really coming together from the shared values and collaborative competencies, right, in order to provide care for that patient. So this is something that takes practice, and that's why we really want to start focusing on interprofessional education, because it's not necessarily something that just happens, right? It's intentional, and we need to really deliberately choose to engage in this type of practice. So you can say that all IPP or IPCP includes elements of these other types of practice, right? They're all multi and interdisciplinary, but it's not always the case the other way. So we want to think about going from this idea of being a group of professionals to being a team of professionals, right? So we want to really aim to go to this really high level of collaboration, have this really shared focus on the outcomes for that patient, and be able to have mutual accountability, right? And in order to really coordinate the care for that patient. So if we think about a group for a moment, we can kind of think of it in this way, where we have one person sort of leading the effort, right? That's in the darker blue up here, and really talking to all of the other disciplines. So there's some level of interaction, but really not that integrated manner. Where if we think about a team, we might still have someone who's really a leader or coordination of the care, but there's all of these other interconnections between the other disciplines. And again, that's where we want to be moving, sort of this shared accountability, this really coordinated and collaborative way of interacting to enhance quality of care for our patients. Okay, so question 2, again, feel free to unmute yourself or pop something into the chat here. So why do we think it's so important for SLPs and audiologists to practice in this collaborative manner? I've started to allude to this a little bit. Okay, good. They need to be treated holistically. Great. And what happens when they're treated holistically? Give best care. Anyone else? So I think we're all kind of dancing around the same thing here. Really, the purpose and importance of providing this collaborative care is really to improve outcomes for our clients. And we have research that's shown us that better care is provided to patients and to our students, right, if we're in that educational setting, when we work together. We know that in the healthcare setting, we have data that shows us that there are fewer medical errors. So we have safer, improved safety for our clients, and also better use of resources. We all know that a lot of our educational and hospital systems are really limited in the resources they have. So if we can really best optimize how we use what we have, that's even better. What's also interesting is that we find that patients and clients are more satisfied with their care, right? Same thing with clinicians. They're more satisfied, have better job satisfaction when we work together as a team, right? It doesn't feel like you're working quite as hard when you're working together versus when you're feeling like you gotta do it all by yourself. And we also have a reduction in healthcare costs. So all really wonderful things. And I wanted to introduce this idea of the quintuple aim. This is a really big overarching principle out in the healthcare world, and really how we got started in this idea of interprofessional collaborative practice. Starting in 2008, when this was first introduced, it started as the triple aim. So it was really just these first 3 parts here. So the goal was to improve patient outcomes, improve our quality of care, so provide better care for our clients, and also to decrease the cost of health. In 2014, it was then expanded to include, it became the quadruple aim. So I realized that, you know, there's been a lot of burnout out there in the healthcare profession, right? That there's a lot of exhaustion, a lot of dissatisfaction among the healthcare workforce. So they added the 4th aim, was resiliency, so sort of the wellness of the team members, and added that as another primary aim to focus on and this collaborative. And then in 21, so just about a year and a half ago at this point, there's been a new push to include equity as our 5th aim. And we know that things like the COVID pandemic has really brought long overdue and much needed attention to lack of health equity in the United States and really around the world. So there's a push to now add this as our 5th aim, and the ability to provide collaborative care can help enhance health equity for a lot of our clients. And I like this quote. So promoting health equity requires collaboration among key stakeholders in health and social systems, developing strategic partnerships and engaging across institutional boundaries to identify local needs, promote best practice, and establishing monitoring and evaluation to ensure these efforts are mutually beneficial and sustainable over time. So we know that when we're working independently, that many healthcare professionals don't have the time, the resources, the skills to make major changes. And it's really only when we kind of pool those resources and skills and work collaboratively across healthcare systems and social systems that we can really advocate for these larger policy changes and solutions that will help many clients, right? Not just one individual. So I think it's wonderful that we're now starting to include this as part of rationale for pushing this interprofessional collaborative. Okay, so let's go back to SLP as an audiologist for just a moment. So ASHA does surveys every year, and they often include questions about interprofessional education, interprofessional practice. And I think this is from the 2019 survey, but it looks pretty similar each year. That about 95% of audiologists and SLPs report that they're engaging in collaborative practice because it's important for professional outcomes and patient outcomes. So in healthcare, these are some of the things they report, that it's better, they can better coordinate and track patient outcomes. They can identify and reduce gaps in medical care more easily when we're working together as a team. And it helps medical teams be more efficient. And this is really important because there's been a push now for value-based care, meaning that we get paid for our services based on the value rather than the volume. So it's not the amount of services that the person receives, it's sort of how are the outcomes, right? How are they receiving and how are they benefiting from your care? And in educational settings, we have reports that it streamlines the process for developing treatment plans and providing additional supports that students may need, that you can incorporate treatment plans and goals from various disciplines so that that care is then coordinated and integrated. And this leads to better overall classroom performance and hopefully greater academic success for those students. Professor Navarra, so your hand is up.
Thank you. I just have a question regarding the surveys, because given the different terms that are being used, I'm wondering if any of these surveys, the terminology is defined so that when clinicians are responding, they are responding in terms of the true definition of interprofessional collaborative practice. And perhaps I'm just wondering if there's any positive skew in the data.
That's true, and it's probably also the problem that these are, they send out thousands and thousands of surveys, and got 1,000 back, which is not bad, but it also takes time and effort to participate in these surveys. So maybe it's a bit self-selecting in who's responding. There's a link on my slide here, and I can send out these links later that actually have links to the survey so you can see. And I don't remember if they provide the exact definition there, but you can tell there is a lot of terminology. So it is feasible that people are sort of mixing those terms together.
Yeah. And the only reason I bring that up is because I think for many of us, we would say, yes, we're engaging in interprofessional practice, but we really are perhaps only in one of those other areas, right? So maybe part of the team that we're working with is not necessarily someone that we're really collaborating with, or perhaps we may be truly collaborating with one member of the team, but not everybody. And so I just was wondering that, because I would say before we started our initiative here at the college with, obviously with your wonderful tutelage and, bringing the CUNY IPE project to campus, I would say that even for someone as an experienced clinician, I really was not fully informed about the differences between these aspects of what we would consider multidisciplinary, interdisciplinary, and interprofessional. And so my own understanding of what I was doing, I think, was not fully informed. So I think I'm mentioning that to the students because I think it's helpful for you as people who are learning about this and who are so fortunate to learn about it at this stage of your education, that even though this is something that we are talking about more and more, that even experienced clinicians may not necessarily be in the place that we want to be. And this is a continually evolving piece of our professional development. So I think that's important for you as students to keep in mind as well.
Thank you. Yeah, and that leads nicely. I have one more slide on importance, and then we're going to go into some of those challenges that come up as well. So we'll talk a bit more about that. I wanted to add just one more piece. This is also from some of those surveys. So what did SLPs and audiologists say motivated themselves? This is self-reported to participate in this interprofessional collaborative practice. So first, not surprisingly, they wanted to improve their patient outcomes. But something that came up as another really big reason is that it improves their relationship with other professionals. So over 70% say that this is really a motivating factor for them to participate in interprofessional collaboration because it improves your relationship with that other professional, and you can really have opportunities to learn from each other out, in practice as well. So as Professor Navarro was saying, that learning doesn't stop when you leave school, right? It's this ongoing process. Other reasons they've stated, it really helps them demonstrate their value and their expertise when you can collaborate. It reduces stress. So again, you're not the only one, right? You have a team behind you, so that helps. And it helps to advance those professional skills, right? So you're continuously learning. So what happens when professionals don't engage in this practice? And I wanted to show you some video clips here from patients themselves and talking about their experiences when interprofessional practice and collaboration did not happen. So let me know how this sounds.
Yes, a few years ago, I went through a very
painful
experience in my life. I had severe back pain and neck pain. So I went to see my primary care doctor, which did an X-ray and just told me to exercise and make sure that I stretched. But the pain was so severe that I just couldn't exercise. So I decided to move on to a chiropractor. And the chiropractor would work on my back and neck, and the pain would go away as soon as I left, of course, her office, but then it would come back in no time. So from the chiropractor, I moved on to a neurologist who gave me a prescription and sent me to a physical therapist. And I would be seen by the physical therapist and the chiropractor at the same time, but there was no communication between these two professionals, and at the end I was left with the pain and being twisted back and forth, which did not help my pain at all. I believe it is important for professionals to work together to bring the best treatment for patients. And if the professionals who worked with me had collaborated together, it would have saved money, time, and it would have saved me some sanity as well.
So hold your thoughts. We're going to watch one more video and then we'll talk about both of them together. So this one was of a patient herself talking about her experience. The next one is a little bit longer, but it's a parent talking about trying to get a diagnosis and care for her child.
It was quite a journey. We realized at age 2, he was really only making one sound. We contacted our local infants and toddlers program and had an evaluation, had a hearing test. Everything was normal, and we started seeing SLP from the infants and toddlers program once a week. He really wasn't making any progress after a few months, and she suggested that we see some additional specialists. We went to Kennedy Krieger, saw a pediatric neurologist. Everything was normal. Had an MRI at Hopkins. Everything was normal. They suggested that we increase the sessions with an SLP. We added 2 sessions with a private practice SLP, and really he made some more progress, but the progress still wasn't there. So she suggested that we get some second opinions, and the second opinions, we went through that. Still, everything was normal. And eventually, I realized that my son's still not talking, and something must be wrong. But I'm going to all of these people, and they're telling me everything's normal. And I looked at it and thought, why aren't these people talking? In my experience, I felt felt like I was the advocate. I felt like it was almost like a Venn diagram, and I was trying to figure out from all of these people what was overlapping, what wasn't overlapping, what was supposed to overlap, what wasn't supposed to overlap, and really trying to figure it all out, figure out who I should be talking to and who should be talking. Eventually, what I did was get a summary from all of the different specialists, and that really helped with putting everything together in one document and sharing it with all of the different people that we were talking to. What they found is that in each report, there were these small, insignificant details, but when you put them all together, it actually ended up being something that was significant that really helped my son's diagnosis. In order for my son to move forward and really make progress, eventually all of these people did somewhat work together. I didn't get them in a room. That would have been great, but it didn't happen. However, putting the summary together really helped, and then having SLPs talk to one another on the phone was excellent in really moving forward and figuring out what he needed. It was a much more holistic approach to what we were trying to accomplish. My son is doing much better now. He's talking. He is still not a normal 3-year-old. However, he has made a ton of progress, and I feel like it was a result of finally getting all of these people together and talking.
Okay.
Yes, it was quite a.
I took just a couple of those key quotes from those 2 videos we just watched, and I wanted to pause here for just a moment and get some reactions, thoughts that pop up in your head when you see those videos. Again, feel free to put them in the chat. You can unmute yourself.
I was gonna say, like, for at least like Carmen, it was like, that's like a very frustrating process, especially if she's in pain. And then she went to a ton of like different professionals, and then they weren't like working together. And so that just like took a lot of like her time, her money, and like, I mean, also it affects your psyche too, because you're like, oh my God, I'm in so much pain, but I go to all these people and all these people are not communicating. And then it's like a whole like circle of like not getting enough help. But like, I feel like it's very frustrating. And like, even with the mother with her son too, like, had they all worked together earlier, I think like they could have made a lot of progress earlier on. So I think that definitely is frustrating if like nobody is like working together and everybody has their own ideas, but they don't want to like come together and like talk it out.
Yeah, definitely frustrating. Do you think this is an uncommon experience? Do you think these are unique situations?
I feel like it's kind of common in a way. Like, I feel like it depends on like the parent too and their involvement sometimes. But from what I mean, I have experience with my younger brother's autistic. And so my parents they're always on IEP, and they're always talking with professionals, and like from their experience, like, you know, they had to actually like push to get professionals to like work together because everybody had like different ideas. So I feel like it's still unfortunately a little bit common for these things to happen. And like, it's unfortunate that like clients have to like actually push for that to happen when it already should be instilled within like the profession.
Yeah, I agree. I think that these are not uncommon. Again, I'll send out these links at the end, but there are more videos posted that you can watch. I'm sure everyone can think of a time when either themselves or a family member or someone they know has had to go through similar experiences, right? Trying to figure out what's going on, how do I get help for this? And that feeling of being sent back and forth without really any communication between professions.
Mm-hmm. Yeah, if I could just make another comment, I'm thinking about the diagram that you put up, the quintuple, and the last one being equity. And so these 2 people had the wherewithal and the resources to continue to seek more information And not everybody has that opportunity. And when I think of some clients that I have worked with in the past, there are, so Erin, your parents, you're saying, had to learn how to navigate the system. And that is something that happens very often. And from a cultural perspective, there are going to be people who are able to push for that. There are going to be other people who do not feel like it's their place, and here's the authority figure, and you listen to them. And so if we think about this also from the standpoint of equity, there are going to be clients who can continue to seek answers. And like Jill, kind of, she was the interprofessional person, right? She put it all together and then kind of forced the issue with the other professionals. But not everybody has the wherewithal to do that. And so it's incumbent upon us to make sure that we're providing that for our patients.
Definitely. Yeah, I agree. I've been in the same situation with clients I've worked with as well. Okay, so we know that we really should be engaging in this collaborative practice. These are some illustrations of what happens when we don't, and we want to do better, know better, right? So what are some of the skills that we need to develop in order to be effective teams together? And there are 4 main competencies that have been defined by this group known as IPEC, or the Interprofessional Education Collaborative. And they revolve around these ideas of values and ethics, roles and responsibilities, interprofessional communications, not just communicating within your own profession, but knowing how to reach out to others, and then the idea of teams and teamwork. So if we look at each one a little bit more closely here, when we're talking about values and ethics, this is that idea that we have mutual respect when we're working with individuals of different professions. And that's closely related to roles and responsibilities. So knowing what is in your area of expertise in your role, and then what are the expertise of the others. And sort of that collaboration is really knowing who to involve and when to involve them, and how their skill set will complement your own skill set and area of expertise. Interprofessional communication, so being able to communicate in a responsive and a responsible manner, right? So knowing how to communicate is just as important as what you're communicating when you're working on a team. And the idea of teamwork and team dynamics, so learning these relationship building values and principles of teamwork, and learning how to really effectively collaborate. That takes deliberate practice and intentional practice to learn how to be a good team member. So what are some of the challenges that come up in this? So the main challenge that's reported by SLPs and audiologists is really that we have limited time, right? We all know we should be doing this, but there's only so much you can do within your 8-hour day or 10-hour day, or however many hours you can fit in one day, right? We know we have really high caseloads and workloads, and we all have a lot to do. And it can be really challenging to fit this in as another thing to do on top of everything else that's expected of us. It's also really interesting that many SLPs report and audiologists report that they never receive any formal training on how to be an effective team member. We learn what's really important in our own discipline and how to be effective practitioners, but there's no formal training on how to interact with others. And this is really why interprofessional education initiatives are sparking up sort of all over, including at CUNY as well. A couple of other challenges that might come up are sort of these organizational and professional cultures. So there might be a negative perception, or we don't really understand the value of why we collaborate. And as we were just discussing, this perception that it's going to add more work to our already busy. A lot of times it's logistics, right? Scheduling conflicts, finding a space to meet, the distance, right? Although some of these challenges are now a little bit easier now that we have Zoom and all of these electronic methods, and have more ways to communicate. But also some power imbalances play into, right? So some of these formal and informal turf wars, like, no, that's my area and I should be doing this and not you. And that can really disrupt team dynamics as well. And then also we should acknowledge that biases can have a role in this as well, both explicit, the ones that we're really consciously aware of, as well as our implicit or unconscious biases that play in. So the question becomes of how do we turn a team of experts, right? We're really skilled in our own area into an expert team. These aren't quite the same thing, right? So we need to go from learning in these silos or learning individually to more of this collaborative educational training. So that's where interprofessional education comes in. And the textbook definition for interprofessional education is when students from 2 or more professions learn about, from, and with each other. And again, keeping this idea of effective collaboration and improved health outcomes as our large goal. And this occurs across many levels, right? It starts right now in your undergraduate program, but this continues to build throughout your graduate education, and really it never ends. It continues on throughout your professional development as well. So this is a model from the World Health Organization, just illustrating this point that we really need this interprofessional education piece, right? This is our foundation, and it's for both present and future healthcare professionals and educational professionals. So that involves students as well as people who are already out there practicing. Again, this is ongoing, continuous learning. And that's really important to make us collaborative ready, right? Being able to then engage and collaborate. So another thought question here. Why do you think it's so important to include IPE in academic curriculum for CST students? You type some messages in the chat or feel free to unmute. What are some ideas? Do you think it's important? What do you think?
And it's okay if you don't know how to answer that.
Yeah. Okay, good. Exactly. Thank you, Rachel. Students to be prepared and have the knowledge to get you ahead of the curve. I like it. Perfect. So we'll build off of that. Great. So we really need to start this as early as possible, right? This idea of collaboration right at that ground level. So when we do that, we can help students who will be future professionals, right? That's how we think of it, to learn to work effectively in interprofessional teams in safe and supported learning environments. We want you to practice now. We want you to make the mistakes now in a safe environment where it's okay to make a mistake, right? Before you get out there into the field. You'd have support from your faculty, from your teachers, right? To learn and to improve on those skills in that supported environment. Starting earlier also helps to cultivate awareness and respect for the other professions. I've had students learn about other professions, and I'm not advocating for you to do this, but some students say, you know what? Nursing sounds really cool. I didn't know they did all these other things. Maybe I'm going to switch over and be a nursing student, right? And kind of find their place on the team. So just learning about and bringing awareness to what the other professionals do. Again, really understanding the skills and the strengths and how each person on the team can contribute. And it helps to discourage those prejudices and those explicit and implicit biases and potential rivalries with other professions. So we have a huge IPE, Interprofessional Education Initiative at CUNY across our whole university system, so all 22 campuses. That began in 2020, right before COVID-19 hit. And it's spearheaded by an amazing woman, Patty Boyce, who is the Dean of Health and Human Services in CUNY. And her goal was to really connect all of the different professional programs across our universities since we are so lucky to have so many right within our immediate region. So we have over 60 health and human services programs, including 4 CSD programs within our community network. So the main objectives are to create accessible and inclusive ways to engage our student and faculty in interprofessional education within our own campus, but also across programs and across campuses. Help students establish entry-level competencies for interprofessional practice, and to help students develop a sense of their own professional identity. Right? So by learning your role on the team helps you define what your role and identity is. So we've taken those core competencies that were defined by IPEC in 2016, and we added a few others that we thought were especially important for our students to engage in. So including things like implicit bias. So learning about those unconscious, those sort of underlying forms of biases that we automatically but unintentionally engage into, and that impacts our judgment and our decisions and our behavior. So learning to recognize those implicit biases that we may not, and think about how that would impact our role on professional teams. We also are explicitly talking about conflict management and have this idea of health equity as a large overarching goal for our students. So as part of this initiative, we've created a lot of different learning activities that are tailored to the level of the learner. And so we have things ranging from people who have never heard anything about interprofessional education, all the way up to experienced practitioners who are engaging in it, right? Because again, this is that continuous process that we're always learning. So we have activities at what we call the exposure level. This is that initial entry point into interprofessional education, where you're exploring these concepts and learning about values and thinking about different contexts that you might engage in interprofessional education, and really getting the opportunity to sort of like dip your toe in and maybe practice these skills just a teeny bit. So some of the activities we have designed and have included are things like online modules, different types of readings to get students engaged, having students participate in structured discussions about specific topics and readings, among others. The next level we have is what we call integration. So this is where you already have that foundational knowledge, but you're starting to then learn to apply that knowledge and skills and be a little bit more critical. So how do we analyze these concepts, values, and context? And I'm going to show you an example in just a moment of one of our simulated interprofessional experiences that actually all of our graduate students, our master's students are participating in. I think this is their 3rd year they've been doing that. So I'll show you some examples. Another type of activity might be a reflection assignment where they might have to reflect back on something they watched or something they read about interprofessional education. And then lastly, we have immersion level, which is where this is the highest of the 3, where you're now really in clinical practice and you're really applying those skills that you've been learning. But again, in a safe environment with some support as well. So this might be observing someone from a different profession and kind of watching and asking questions and interviewing them on how they're doing it, why they're doing it, to learn about their role. We might do another type of activity called a simulated grand round. So grand round is when you have lots of medical professionals gather together, discuss a specific case. So you might have a student participate in something like that that's simulated with other students in different disciplines. So I'm going to show you a few of the activities we've been doing at Queens College specifically. The first one is the virtual simulation. So in a virtual simulation, students are presented with a clinical case. So we're having our graduate level SLP students participate right now in this. And what they do is they're given this clinical case and they get about a week to read through this case and kind of think about, all of the information that's in it, ask questions, do their own background research there. And then we have a Zoom meeting with students from other disciplines who also have prepared the case, and they simulate a care planning meeting. So they're pretending that they're the profession that they're studying, and they're meeting together to discuss a specific clinical case. They have about 30 minutes to discuss among themselves. And then at the end, we have a period of reflection that we call a debrief. And it's led by a professor who's asking questions specifically about how did they feel when they were interacting with other professions? What did they learn? What did they learn about their own profession? Prompting them to really think back about that experience working together and maybe reflect on some things they may have done differently. They had to do it again. So the case that we've been working through the most is a case, we've been calling it the COVID case. So it's a patient who was diagnosed with COVID and had a CVA, which is another way to say a stroke, cerebrovascular accident. And the case tracks this patient across 3 points in their care. So the video clip I'm going to show you next is a simulation. It's faculty members pretending to be students in these roles. Thinking about how this patient might transfer, so move out of an intensive care unit to a lower level of care, so more of a regular hospital bed unit. In the simulation, again, the student is playing their respective discipline. So if I was an SLP student, I would be playing SLP in this scenario. The video I'm going to show is about 5 minutes, so you'll get a sense of it. In the first part, they'll be simulating the case, and then they'll be working on through their reflections. So again, these are faculty members, but they're pretending to be students.
Good evening, everyone, and welcome. I'm so excited to have you here for the CUNY interprofessional simulation.
Ann Thomas is a 65-year-old who identifies as a female. She was admitted to the COVID ICU 3 weeks ago in severe respiratory distress, and she had a right-sided CVA with left-sided weakness. I can just quickly give a brief overview from the social work perspective. Ms. Thomas lives with her husband. Her husband does work full-time. He's able to take off a bit of time, but he won't be able to provide 24-hour supervision. Additionally, Ms. Thomas she's presenting with moderate anxiety and depression using the GAD-7 and the PHQ-9.
I'm Gwen Lancaster. I'm a nurse, I'm nursing, and one of the things that I would be interested in is to make sure that her vital signs and she's actually ready to be discharged. I would do a physical assessment on her, talk to her about her, what's going to happen when she's discharged, go over her medications, ask her if she has any questions, things like that. As the case goes on, depending on how she responds to the questions, I'll continue an assessment and make recommendations.
Well, I guess from a medical point of view, it sounds like she's well enough to go home now, but we would want to make sure that all of her medications that she's taken can be changed over to oral medications. I would want to know how she's doing in terms of having a physical therapy or occupational therapy follow-up, because she did have a stroke, and I would want to make sure I know when her follow-up appointment with her past PMD is, make sure that that PMD knows about what happened to her in the hospital so that she has a good transition of care from her inpatient to her outpatient.
My name is Parisa Asasi. From a public health perspective, I was wondering how we are going to manage the safety in his apartment, and also her husband is not being at home to take care of her full time. So who is going to take care of her when her husband is not there?
Can pick that up from a nutrition perspective. She is currently on a mechanical soft diet with thin liquids, and speech language therapy is following her for her difficulties with swallowing. If she were to be alone at home, somebody would have to be there when she consumes food, because there is a risk of aspiration. And I agree that occupational therapy needs to follow up with her, because we observe that she may need some adaptive feeding tools.
From the nursing perspective, I see what she's saying with the nutrition. We would also follow up with that. We do some phone calls, some follow-up phone calls to see how she's doing. Do you have any questions? Is there someone that we can reach out to help her as well? Maybe a family friend or something to that nature that may be able to come in and make sure that she's getting what she needs.
So now what we're going to do is the debriefing. So I have a couple of questions just to ask you, just to see how you felt about the process. So, what was it like to work with other professions? What did that feel like?
I mean, I was nervous also. I think trying to, keep all the pieces straight and think about, what we're going to do as far as the plan of care. But it's exciting also to be able to work with other professionals. It was great to hear everyone's perspective.
Thank you for sharing. Someone else?
I was impressed at the different perspectives of everybody, of the patient, things that we don't necessarily think about in nutrition, like transitioning the drugs to drugs she can take at home. That was very interesting for me.
Yeah, I think a lot of times we don't realize that there are all these other things that the patient needs, and we just kind of fixate on the medicines and we forget about the other things. So I think it was great listening to the other people talk about things that this patient really needs, probably even more than the medicines that I was mentioning, and I might not have even thought about that.
So we'll stop there. So you get the idea. Our students have really positive responses to that. I think my favorite response I get from students is, wow, I really did know something. I really knew, I really was able to contribute and participate and learn from these experiences. So it's really wonderful. So again, as Professor Navarro said, don't worry about all the terminology, just so really how we can practice these interprofessional teams.
Mm-hmm. Mm-hmm. Yeah, the other comment that I like to hear is when the students say, I didn't realize how much we have in common with some of the other disciplines, which is, part of what we want to teach students, and knowing what you do, not only what you don't know, but what you do have in common with other professionals is so helpful, because then even though you might be looking at something from a different perspective, in many ways you are on the same page. So that's also a very interesting thing to hear the students talk about as well.
Yes, Missy Christina said that was really informative. Thanks for that comment. Any other reactions or thoughts you want to share about that, Shanat? Well, if you think of something, feel free to put it in the chat as well. I wanted to highlight just two other IPE activities that we've had go on our campus. The first one was last spring, we ran an alumni panel. So we had graduates from our different programs come and talk on a panel about how they engage in collaborative practice in their settings. So we had a whole host of different professions represented there, which was really wonderful. It was also a great networking opportunity for students from the different Queens campuses, CUNY campuses. So I think we had Queensborough, York, and Queens College. I think it was those three, maybe another one in there too. So we had students from those three campuses come together at Queens College and just get to meet each other, interact with each other, kind of talk about their respective programs and disciplines. That was a really wonderful event. And then very recently, just a few weeks ago, we ran a program with our SLP students and the nutrition students who are on our campus. And they worked together to practice swallow screening and learn about nutritional assessments. And they got to do oral motor exams on each other. And it was a really fun experience for them, again, to network and to meet each other and learn together. I think there was a really positive response to that as well. I also wanted to point out there are these free online modules. These are actually sort of those initial entry points. If you are interested to go ahead and learn a little bit more about IPE, this is a great and free resource that you can have. You can either just Google the name Maria Garcia IPE series, or again, I'll include this on the links that I send out. They're free modules that you can go through. They're about an hour each. Not mandatory, just some additional information. And then lastly, I want to hear from you. So are you learning about this in any of your classes? Also, you know, what are you interested? What other types of IPE activities would you like to attend? Would you like to participate in? It could be anywhere from, you know, we're hoping to do some more panel presentations, but even things like social events and mixers with students from other professions, just again, to talk and learn about each other and what you're learning in the undergraduate level, if, you know, they need to go on to the graduate level, et cetera. So you can either email me, my email is up here. I'm in Queens Hall almost every day, so feel free to pop into my office. I'm in 350B, tucked away in a little corner, but feel free to come find me. And I really want to hear your input because we want to start, we've done a lot in the last few years at the graduate level, and a goal for us is to now try to get some of the undergraduates involved as well. Any immediate thoughts? If you want to think it over and let me know.
I think what would be cool, because I mean, I'm graduating, but I think observing simulated sessions would be really cool thing to have for future undergraduate students. I think because the more you observe, the more you learn. And I personally wish like I was able to be more involved in that, but I think for like underclassmen, it would be great. And I think mixer events are cool too, because you get like different perspectives from others. So that would be really cool.
Yeah, I think so too. The social events are really fun too, right? That's again also real world, right? We don't just, oftentimes you're the only SLP in the building, right? So you get to really learn and work with one. So I'll send that to Erin and Sophia so she can pass that along. I'll stick on for a couple more minutes if anyone has any questions, but happy to be here and thanks for inviting me to talk about this important topic.
Yeah, thank you so much for presenting. I learned a lot, honestly. That was a really great presentation.
Thank you.
Yeah. Do you guys have any questions?
Yeah, I just wanted to thank Professor Steinberg-Lowe again for taking the time to do this and such a beautifully well-organized presentation that gives us a really wonderful overview of what interprofessional education and interprofessional collaborative practice is. And I'm sure for many of you, this is probably the first time that you're even hearing this, you know, what this is, right? Have ever heard about this. And so, so again, you know, we really just want to extend our gratitude to Professor Steinberg-Lowe because this is something that is really, really becoming very important in our field and is now we're finding in the standards for accreditation for graduate programs. And so for those of you who are moving on to graduate education, either next year or the year after, you are going to find that this is going to be a component of your graduate education to some degree. And hopefully you will be seeing, you know, some of the initiatives like we have here at CUNY, wherever you go to graduate school, so that when you do enter the field and become our colleagues, that you are starting off on a really, really great foot.
Yeah, thank you so much for that, Professor Navarro, and thank you so much, Professor Steinberg, for coming to talk with us today. Just another reminder, our last meeting for NSSLHA is May 3rd, so this is a time to celebrate you all. It's going to be my last time here, but I'm super excited for the future. So yeah, join us. And yeah, thank you guys so much. And also come to the walk.
Yes, join us on Saturday.
Yeah, please join us.
I'm hoping to be there with my daughter, so hopefully we'll see some.
Oh, yay. So nice. All right, so I think that's all for today. So just stay tuned for May 3rd and please come to the walk. All right.
Okay. All right. Thank you.
Thank you.
Okay, bye-bye.